This conference will now be recorded.
Okay. Good morning, everybody. Welcome to our webinar this morning. Our webinar is how to manage indoor air quality in arenas. And it's being hosted by Saskatchewan Parks and Recreation Association. I'll be your host today. My name is Tim Hanna. I'm the consultant for facilities and training with SPRA. I'm going to turn off my video for most of the event today because of my slow internet access here at my house. Okay, so let's get started. Okay. Okay, so again, I'm your host for today's webinar. And in support of the webinar, our SPRA staff in the background, we have Ryan Monks, who's like our director, and our producer will be Christy Wilson. She'll be helping with questions at the end of the session. The maximum time that we have allotted for our webinar this morning is an hour and a half. So I think we'll wrap up within that time for sure. If there's any questions that are outstanding after that time, I can stick around and gather up those questions and we can forward those to you after the event as well with some follow-up. The session is recorded, as you heard, and it will be available after the webinar. Some of the information presented today by the presenters will be available as well, so that'll be passed along. So thank you for participating, and it's going to be the format today. We have 4 people presenting in a panel, and then we'll have questions and answers after that. So if you have a question during the presentation, I'm going to ask you to hold off until the end. And when we get to that point in time, you can certainly raise your hand and unmute yourself and ask your question, or you can go through the chat feature as well. Okay, and certainly you're welcome to leave your video on during the presentation if you wish. So SPRA, who are we? Well, our vision is we envision a Saskatchewan in which all people have equitable access to recreation experiences that contribute to their health and well-being, result in connected and engaged community members, and provide connection and attachment to the natural environment. And our mission is this: we provide leadership, support, and services that contribute to recreation's impact on the quality of life for people in Saskatchewan. And finally, and very important, our program, services, and support reaches lands covered by Treaties 2, 4, 5, 6, 8, and 10, the traditional territories of the Cree, Dakota, Dene, Lakota, Dakota, and the Saulteaux peoples, and the homeland of the Métis. And finally, just want to say a quick thank you to Sask Lotteries for their financial support to SPRA. Indoor air quality. Why is it an important topic? Well, there's many reasons, and we'll get into those throughout the presentation today. But 2 you most often hear about are occupational health and safety of those working in facilities, and of course, the public health side of things when people come to your facilities. In the past, there's been several occurrences of indoor air quality issues in arenas, and there's been a few this winter season as well. And of course, when you have an incident of bad air quality in your arena, they make for very good news. So they're very newsworthy, and you often hear about them even on, national newscasts as well. The owner and operator certainly are important pieces of this puzzle, as you are legally responsible for ensuring a safe recreation facility. So what are some of the learning outcomes from today's presentations? Well, there's several. First, you're going to learn what the standards are. Next, you'll learn how to maintain your indoor air quality standards through some best practices. You'll learn how mechanical air handling and ventilation systems can help achieve those standards. You'll learn too how to monitor your indoor air quality using today's technology. You'll hear about some practical solutions that you can be incorporated into your general day-to-day activities, and where to go for help when necessary. Are there roadblocks for indoor air quality? Well, yes, there are. Okay, old facilities certainly have challenges because they weren't designed with indoor air quality in mind back in the 60s, 70s, and maybe even the 80s. And Ted maybe can touch on that as well. We have some ventilation circulation systems like that big, large exhaust fan you'll see sticking out at the end of the rink wall. But is that enough? You often hear we don't have the financial resources to make any changes, and you'll hear more about that today as well. Another problem from an ice maker's point of view is how can I manage my ice quality when I need to ventilate and circulate air around? It does make it more difficult. You'll even hear this argument, ventilating or circulating air adds costs in my arena operation. And the mindset that I've heard many times in the past with training is we've been doing things the same way for 40 years and never had a problem. And I'm wondering sometimes if that's more by luck than by design. So today's presentation will help you on a path to help with positive changes that you can make to improve your indoor air quality in your arena. So the panelists for today's conversation are Ted Cook, professional engineer from HDA Engineering. He's the mechanical designer and partner with the firm. We have Ryan Philippation. He's a certified public health inspector with the Saskatchewan Health Authority. He's the senior public health inspector from the Public Health Office in Melfort. We also have Warren Thiel, if I pronounce that right, and Jason Lewandowski, if I pronounce that right, from DMA Control Applied Controls. And Warren is the project engineer and Jason is the service manager. And then I'll come on at the end and do a little bit of blurb from an SPRA point of view. So I would like to throw it over to Ted to start the presentation now. Ryan, can you help with the share screen?
No, I think we'll just listen on here.
That's fine with me. We can listen on there. Oh, no, we can't.
If possible, can you mute yourselves? Someone has a speaker on.
I assume everyone can see the presentation there.
Good to go, Ted.
All right. So today we're here to talk about indoor air quality in arenas. As stated, I'm Ted Cook with HDA Engineering. I've been designing mechanical systems since 1996, or a very long time, including arena designs. Sorry, and then I ran into a technical problem. It won't let me advance this slide. There we go. So what is indoor air quality? It is important to understand that all air contains contaminants, right? And our health is only impacted when the concentration level of contaminants exceed what our bodies can handle. And different people will have different tolerances to contaminants. So essentially, if we are in a room with a small amount of contaminants, we are fine. But if those concentration levels climb up too high, it can be dangerous to our health. So indoor air quality is maintaining acceptable levels of contaminants within an occupied space to facilitate human comfort and reduce the risk of adverse health effects for those people. There are 4 factors that affect indoor air quality: how much the pollution source is releasing to the space or the rate of contamination, how long someone can be in that space at the concentration levels observed before they show adverse health effects, and the rate at which we're diluting or ventilating the space between ventilation and exhaust to reduce those contamination levels or contaminant levels, and finally, a person's individual sensitivity to contaminants or pollutants that are being released. So there are 3 pillars to achieving good indoor air quality in enclosed environments. The first one is containment, where we focus on isolating and containing the pollution sources and separating them from occupants and the occupied spaces. The next is capture removal, where we aim to remove the polluting source or capture and remove contaminants from the space to reduce its concentration levels within the space. And finally, dilution, where we're going to introduce clean air, again, to further dilute the contaminants and bring those levels down to an acceptable level for human occupancy. So indoor air quality is easiest to maintain when all 3 work together or in conjunction to ensure the spaces are safe for the expected periods of exposure, But in many cases, we are not able to achieve containment, and we rely on capture, removal, and dilution for occupied spaces. So containment, again, the purpose of containment is to separate pollution sources and associated contaminants from the occupant. So as seen here, generally we're putting barriers or separations in between where the pollution is or is being generated and where we want to keep spaces clean for the occupants. For most polluting material in buildings, we tend to try to gather the material together in things like garbage cans, recycling bins, etc., and move those to soiled spaces that are separated from the occupied space until that potential polluting source can be removed from the building entirely. To help contain contaminants, we do designate soiled rooms in the facility where either the room function results in contaminants, rooms like change rooms, janitor rooms, washrooms, or where off-gassing material is stored. Again, janitor rooms, often chemicals are stored there, or other spaces where material that off-gasses contaminants is stored and separated from the occupied people or occupied spaces. So as seen here, if we have a soiled room, a room that's been designated either by function or what is stored in it as a soiled room, we allow the pollutant sources to off-gas into that room and it will contaminate that space. And then we provide separation between the rooms from our occupied space. So our occupied space will stay relatively clean compared to where that off-gassing or where that pollution is happening. It is also important, part of containment, are plumbing traps, which are critical to separate the occupied space from sewer gas. And plumbing traps throughout your building will have the side open to the space, like the floor drain, or the sink drain will be open to the space. And to separate from the sewer gases so they don't release, water is kept in the trap to create a seal and prevent sewer gases, again, from being released into the occupied space. And that's all part of containing the contaminants. First and foremost, pollution sources that have been contained need to be removed before they become a greater issue. So things like your materials, garbage, recycling, things that are polluting the space, those pollutant strengths, especially the garbage, increase over time as the material deteriorates. So we want to make sure our removal intervals are reasonably keeping the spaces protected, so we're not off-gassing too much contaminants into the building. Filtration in our air systems is utilized to capture contaminants directly from the air streams, which then is removing that contaminant from the building and reducing concentration levels in the occupied spaces. And again, that works for recirculated systems or makeup air systems that only bring in fresh air. We should always be filtering them. You can use high volume recirculation filtration systems or air purifiers, air cleaners, to also help reduce contaminant levels in spaces where contaminants are being released. But when using these, you still need to properly ventilate the space. You still need outside air or dilution to be introduced. Capture and removal. In addition to filtration, we want to capture and remove the contaminants, generally using exhaust systems. So exhaust fans are put in place to extract contaminated air from the soiled spaces or spaces in which contaminants are off-gassing. This removes a portion of the contaminants from the building, reducing the concentration levels in the space. And when properly installed, the exhaust systems also facilitate containment by drawing the space negative or the soiled area negative. So when we have a pollutant source in a space that is off-gassing contaminants or releasing contaminants, that space is going to become contaminated. The best thing to do for exhaust, if you can achieve it, is capture exhaust systems, things like kitchen hoods, where they're going to actually be placed very close to the contaminant source, and they're going to capture this higher concentration of contaminants being released into the space. In many cases, we cannot implement capture exhaust systems, so we rely on general exhaust, which is going to remove the mixed air from the space, which contains a portion of the contaminants, but isn't as effective as getting that source captured very close to the source. To help containment and better protect the clean spaces, you try to implement a push-pull design where you're going to introduce the ventilation, fresh, clean air to those occupied spaces that we're trying to keep cleaner, which is now going to push towards the soiled spaces or contaminated spaces that we are also drawing negative with exhaust so that we can, again, help containment and keep this occupied space cleaner and better for the occupants. And for that, we want in our buildings that air movement is always going from a clean space to the dirty spaces. And that's something as operators you should be aware of, or make sure systems are operating properly to get that transfer from clean to dirty. And the last pillar brings up the old adage, the solution to pollution is dilution. With dilution, we use a combination of removing the air from the contaminated spaces through the exhaust, and then replacing that with clean air, either from outside through an air handling system or through transfer air from cleaner spaces to dirty spaces. So if we start with a clean space, if you have a clean space that people are going to be in, or it could be occupied, and we introduce a pollution source into that space and we do nothing about it, that pollutant is going to contaminate to the space. Over time, that concentration will continue to increase as the source is active or releasing contaminants, and that space will become unoccupiable. So we try to, through the dilution portion in the same space, exhaust, again, contaminants from the space and introduce ventilation into the space while the source is active or while there's contaminants. And we want to reach a point, or if we have enough air change rate entirely, that the space air itself, the mixed air, is breathable and occupiable even when the contaminant source is active. Even with a single space where you cannot separate the pollutants, so we don't have any separation here from pollutants and the people, the design of the system should still promote containment, again, through that push-pull concept where you're going to have your supply air, makeup air, fresh air delivered mostly where the occupants are, trying to push the contaminants that are being created towards the exhaust systems. And that again promotes or helps keep the concentration levels lower and keeps the HVAC system more effective in diluting the space. So when talking about indoor air quality in rinks, I tend to separate the issues into two categories. The first is human comfort or irritants, where we're dealing with irritants that make it difficult for people to be in the space, but generally do not lead to health concerns for most people. So this includes sources like human bioeffluent. So anytime we occupy a space, we contaminate it. We are constantly releasing or off-gassing contaminants. So when a space is occupied, we're contaminating that space. Volatile organic compounds, and that's the particles that off-gas off material that are brought into the space or occupy the space itself. Any airborne particulates, dust, pollen, hair, anything in the air that is a particulate can again affect people's health or affect people's comfort in the space. Allergens, airborne allergens will affect people susceptible to them. And again, odors impact people's comfort in the space, and sewer gas impacts people's or perception in the space as well. The second category is health and safety, where the contaminants will impact the health and safety of most occupants and is often regulated by things like occupational health and safety or other guidelines to ensure that people aren't affected. This includes carbon monoxide and nitrogen dioxide from vehicle exhausts. It would include things like mold, fungus, and bacteria, radon, and viruses. So when we fail to address indoor air quality for human comfort, the irritant concentration levels can increase to the point that they do affect people and will lead to complaints of headache, malaise, nausea, eye and throat irritation. In most cases, this does not result in adverse health effects, or the people affected will not be hospitalized or permanently affected in any manner. But if concentration levels get too high, these irritants can become a health risk themselves. Even with properly ventilated buildings, it is important to again focus on containing pollution sources to make the ventilation system more effective. We must ensure pollutant sources are properly stored, that the soiled rooms where they're stored in or where most pollution is generated are separated from the occupied spaces, and that the exhaust systems in the building are moving air through that space to get the contaminants out, and that air is moving from our cleaner spaces to our dirtier spaces through the buildings. Again, it's important to verify plumbing traps are not dry. When they are not filled with water, sewer gas will seep into the space and can create IAQ problems. Most indoor air quality for human comfort is addressed through proper ventilation of the building. And it is also legally mandated under the National Building Code that you properly ventilate buildings in accordance with ASHRAE 62.1. What ASHRAE 62.1 identifies is the following. It identifies a rate of ventilation that's required to address the occupant load or the human bioeffluent from people. And that is based on how many people or the maximum number of people are permitted in the space and what they are doing in that space. So, for example, more ventilation per person is required when it's a gym versus an office, because the bioeffluent load for people in the gym is greater than with people in the office. The second thing ASHRAE says is that you have to introduce ventilation just based on the space by function. So even if a space is unoccupied, a transfer space or storage rooms or things like that, where we aren't actually creating pollutants in the space itself, those spaces still need fresh air. And so a portion of air is identified just on the space function and the area of the space that we have to ventilate at particular rates. And again, depending on what's in the space or the expected VOC or contaminant load, that rate will change space to space. And the last thing, soiled spaces, ASHRAE identifies the exhaust rate or the air change rate needed for the soiled spaces, again, by function. So exhaust requirements for a vehicle storage area are higher than exhaust requirements for washrooms. And that's due to the expected contaminants that are going to be produced in those spaces. For your building, your total outside air introduced to the building for either through ventilation or makeup air must be the greater of either the combination of the ventilation rate for the occupied spaces or enough makeup air to equal the exhaust being removed from soiled spaces. Filtration is an important part of capturing and removing the contaminants for human comfort. As such, we should always filter any of the air being introduced to the space, either if it's recirculated air or, again, makeup air or fresh air. We should filter that air being delivered to remove contaminants and keep our contaminant levels low. In terms of the type of filtration, filter efficiency is designated or identified through a MERV rating, and the higher the MERV rating, the better the filtration you are getting. However, if you have an existing system and you want to increase the filtration, there is a chance that you will decrease the overall airflow rate because that system was not designed for the higher static pressure you will see through better filtration. So when you're buying new systems, you want to buy them to have an appropriate filtration rate. What would be considered the minimum for buildings or for commercial buildings is a MERV 13. And generally, you should have a MERV 8 in front of that to lower your overall replacement costs. But a lot of systems that are put in, especially in older rinks, will only have a spot for a MERV 8 filter. And again, if you went to or put a MERV 13 in there, you could reduce the airflow, the total airflow to the space, which will reduce your dilution effect, and it might not improve, or the better filtration might not improve the space. And it's critical to properly maintain filters. Overloaded filters do not function to remove the contaminants properly. And if left too long, like this picture up here, they will collapse, removing all filtration from the airflow. Most large systems will have magnehelic gauges, which help you as an operator identify when the filter is properly loaded or fully loaded by paying attention to the pressure drop across the filter. And when the pressure drop gets to its fully loaded rating, you should replace the filters. So the other items are addressing indoor air quality for health and safety. The most common issue in rinks are combustion fumes. carbon monoxide, and nitrogen dioxide. These gases are generated from any combustion source, but are mostly an issue from operating vehicles in the space, like the ice resurfacer, or in some rings they'll hold car shows, so moving the vehicles in and out, and using a telehandler to move material in and out of the building will contaminate the space with combustion fumes. However, your HVAC systems, if they have a component or parts of them are failed, can release combustion gases into the occupied space. When the HVAC systems are set up properly or working properly, they should not release any combustion fumes into the building. So this is only when you have failed equipment or failing components. When burning, either fuel source generates both gases, CO and NO2. But if you have natural gas-fired appliances, you're generally going to push up the carbon monoxide levels higher. And if you have diesel sources, it's going to increase NO2 at a greater rate. With rinks, some additional issues. NO2 itself is heavier than air and can be trapped over the playing surface due to the rink boards. Air movement itself and disturbing. If you don't have reasonable air movement to disturb the fumes, again, those boards can help contain them in the occupied or breathing zone. And the increased ventilation and air movement can lead to poor ice without proper dehumidification. So if you have, especially if you're introducing outside air, you need to be sure that you dehumidify it so you're not creating other problems in the rink. And again, if we're going to increase air movement, we want that air to be very dry so it's not affecting things or it affects the ice quality less. So because we're talking about health with CONO2, exposure levels are defined by occupational health and safety by law. And it's based on exposure time and a concentration level. All right, so for carbon monoxide, your 8-hour exposure limit under health and safety is 25 parts per million, and your 15-minute exposure time is 190 parts per million. With NO2, your 8-hour exposure limit is 3 parts per million, and your 15-minute exposure rate is 5 parts per million. With NO2, the general we'll talk about later, SaskHealth recommends a lower exposure limit, again, with concerns over people's health, and those are recommendations, and this is the law. You must keep these buildings below here by law. So addressing the health side, CONO2, you are required to keep those concentration levels below those exposure limits. And this is usually done through ventilation and exhaust systems. Because you have to ventilate the building to your ventilation rates by ASHRAE and you're introducing additional contaminants, this often requires a purge system or a higher level of ventilation and exhaust when you have a vehicle running in that space. And the purge or high ventilation is often needed as you cannot do source capture on your resurfacer or the vehicles moving around. You can implement source capture in the storage room. If you ever run your ice resurfacer in the storage room, you can have it with a snorkel or an exhaust system that ensures that room is well protected. But the ice surface area, we can't do source capture. And so we need that high level of air change rate when it's active in order to reduce those concentration levels. And especially on the short time you might have between periods or between activities on the ice surface. If there is no purge level installed, you must ensure that the ventilation systems operating in the space are capable of removing the fumes. And as Tim alluded earlier, if you just have a prop fan at the end of the building that does not move or promote that push-pull very well and does not necessarily mean you're cleaning the ice surface of the contaminants. In lieu of a purge system, you can use high volume recirculating air cleaners specifically designed for CONOx removal. And again, if you're using an air purifier and air cleaner, you have to make sure it's actually rated to remove those fumes, as most do not. And that allows you to reduce the overall outside air level, which again, if you bring in lots of outside air, you have to dehumidify it. So a recirculating system can help reduce the concentration levels without creating other problems for the ice quality. You must still if you use recirculating filtration or air cleaners, you must still provide ventilation to the space in accordance with human comfort requirements or ASHRAE 62. You should monitor the levels of CO NOx in the space to again help ensure you're protecting the people that are occupying the space, and help you identify if systems are not working properly or working are not properly working over time, which relates to maintenance and having to deal with that. When monitoring, breaching the 15-minute high limit should result in a local alarm that people are meant to get out. If you get above 190, again, you're only allowed to be there for 15 minutes. People should probably leave. The 8-hour exposure limit allows a pre-warning to operators. So if we have that limit set at 30 minutes or an hour, it gives you a chance to go in and find out why we're not keeping the levels down below that exposure limit, which again, people are allowed to be in the space for 8 hours at less than 25 parts per million for CO and less than 3 parts per million for NO2. And having that early warning, which again wouldn't necessarily require people to leave the space, allows the operator to find out what's not working properly or why we're not removing the air or the contaminants. If you are not getting sufficient air movement over the rink surface, and again with those rink boards potentially containing the fumes, you can use high volume, low velocity fans to stir the air, and that will reduce the effect on the ice surface. So you just want a fan that's going to push the air almost right down to the ice surface, again, just to create some circulation and make sure that the contaminants are getting up into or mixing with the general air, so your general exhaust systems can then remove them and improve or make it more effective in removing the contaminants and keeping those exposure levels down. In my opinion, those CO-NO2 systems, you should be alarming locally, again, if you exceed that 15-minute rate, to allow people to leave and protect them from not being exposed to the harmful effects of CO-NO2. When using the resurfacer, because of the containment with the boards, we want to create a pathway or have a pathway open where the heavier fumes can spill out into the larger volume of the building, again, to promote the mixing and dilution of those concentration levels. So you want to leave some of the boards, especially when you bring the resurfacer in, you want to leave those open so that, again, those fumes can spill out into the space and get mixed or diluted. I can talk a little bit about purge control. If you have a purge system, you want that purge system to engage upon detection of fumes. So the moment it detects fumes, the purge system should kick on. It should remain in operation until the concentration levels are basically brought down to an what the minimum monitoring of your sensors would achieve. So the moment we detect fumes for CO, if we detect 10 or 15 parts per million, we're going to kick that system on and try again to pull it down to make sure we never get above that 25. And then we'll shut it off only when we're basically at zero or at what the sensors can detect, the error on the sensors. So other health concerns for rinks: mold, bacteria, and fungus. Preventing the propagation of mold, bacteria, and fungus relies on primarily two things. We want our spaces dry. That's the most critical. And we want to remove what they feed on, which is organic material. So the organisms feed on organic material, and if it's wet, it's an environment that they can grow in. So we need to keep spaces dry, and we want to remove all that material they could feed on: boxes, paper, organic waste. But even surfaces where dust accumulates or dirt accumulates, we need to have those wiped down or removed. It's critical that wet rooms, so soiled rooms where moisture occurs, change rooms or shower rooms or bathrooms, are exhausted, that those rooms are negative, so that moisture is contained in those soiled spaces, and that air again is moving from clean to dirty. And because of the issues with rinks and moisture and dehumidification, we do want the air to actually move from the rink to those change rooms because we want that moisture to be contained over there. Exhausts themselves will not deal with standing water, so we must ensure we generally do not have standing water, that things are draining properly, the water is being moved away. If we have pipe leaks or water sources that are leaks or roof leaks, etc. We want to try to address those as quickly as we can. So again, we don't have standing water anywhere in the building. And dehumidification is critical for rinks and for ice quality to prevent moisture on surfaces. If rinks are not properly dehumidified, you can end up with, again, mold and bacteria growth on surfaces, on boards, throughout the rink. So to prevent moisture on surfaces, it's critical that the rink air is drier than the dew point for the rink surfaces. And that depends on what temperatures you keep your building at, or the room temperatures, and what temperatures the surfaces are. But we want to have dehumidification working to make sure that that space is dry enough. Radon. Radon is an invisible, odorless, tasteless radioactive gas that comes from radioactive decay of elements in the ground like uranium and radium. We have a lot of it, or a lot of risk of it, in Saskatchewan. For commercial buildings with proper ventilation, so if your building is properly ventilated, radon is not usually a problem. And that's because in commercial buildings, we generally have a higher ventilation rate and a higher air movement rate than, let's say, at your home. To better protect people, or if you're concerned about it, you can ensure ventilation operates before the building is occupied. And that would just ensure if there was any radon accumulation when the building was unoccupied, that it's purged out before anyone gets in the building, or again, those concentration levels are kept low enough. And if you are concerned about radiation, you can test for it, and you should use long-term do-it-yourself test kits, which take several months of readings to determine if you're over the acceptable level. And you can refer to Canadian Health indicates those levels and requirements. So a quick summary through all this: to ensure you have IAQ controls or controlled in buildings, in rinks, we need to ensure all spaces are properly ventilated. So systems serving occupied spaces, your air handling units, your makeup airs, they need to deliver outside air to those occupied spaces. If you have a mixed air system, you can't be overriding the outside air dampers, so they're closed all the time. You need to ventilate those spaces, and those systems are meant or designed to deliver that ventilation to the space. Soiled spaces, we need to ensure they are being exhausted, that those exhaust fans are running, they're working when the space is occupied, that soil space is under negative pressure. So again, air is moving from outside that space into that space, which helps with the containment. Need to ensure plumbing traps, again, have water in them so that sewer gas isn't releasing into the building. For CO-NO2, the rink ventilation and exhaust systems have to operate to keep those CO-NO2 levels below the exposure limits. You need to monitor or determine if they are currently working to do so, and if they aren't, it will probably mean that you have to change the systems or add additional systems to get those concentration levels down. Again, ensure there's a pathway for the heavier fumes to escape the rink boards when you're resurfacing. And you should monitor those CO-NO2 levels to protect the people. So you should monitor and have some local alarms in the areas where you use the vehicles to protect occupants in the space. And then proper dehumidification. You should be ensuring that that rink is dry enough, both for the ice quality, but also to prevent mold and bacteria growth in the space. And that's the end of my talk.
Well, thank you very much, Ted, for sharing that expertise. There's certainly a lot to comprehend there. And I'm sure many have questions that they want to ask about the engineering aspects of this, but we can share those at the end during the question and answer period. Our next presenter is Ryan Philippation from Saskatchewan Health Authority. So Ryan, we'll get you shared up to share your screen.
Thanks, Tim. Just want to start off saying thanks for the opportunity to present to this group. Really enjoyed Ted's presentation, and I'm looking to build on that with a little bit of talk on the importance of ventilation in your indoor air arenas. So we'll get started. I see it's up. Ryan, thank you for controlling my slides. I was having some technical issues, so we'll just jump on to the next slide, please. So just a quick disclaimer is that Saskatchewan Health Authority is currently updating the arena guidance and information sheets So information presented today, it's subject to change. We do have a task group in the Saskatchewan Health Authority that's working here, and it's anticipated that in the next 8 weeks there will be some updated guidance documents that we'll be able to share, hopefully with these arena operators and our communities. Next slide. A little bit of a talk today that we'll look at. I'm going to just give a little introduction. I'll speak briefly about carbon monoxide and nitrogen dioxide to ensure that we're both on the same page of what these poisons can do in the arenas. We'll talk about an arena air quality program, and that'll be the basis of my presentation. Is if your local community doesn't have a monitoring program in place, we definitely want to make sure that you guys are aware of the importance of having a written plan as well as a monitoring plan for air quality in your arenas. I'll discuss a few abatement issues, some key points and takeaways from today's presentation, and then Tim said we'll have some questions at the end of the session if there's time. Next slide, please. So we know that our indoor skating arenas are a major hub of social activity in every community in Saskatchewan. However, if not maintained, we have seen that they can pose a health hazard to our users and our spectators, as well as staff that work in those facilities. The exhaust from fossil fuel powered equipment operating in indoor arenas can make people ill, and we're going to discuss some of that in the presentation. And building on Ted's presentation, inadequate ventilation may allow combustion gases, such as exhaust, to collect at the ice surface. So we'll talk about what we can do in our arenas to minimize the impact from the exhaust of our fossil fuel equipment. Thank you. Next slide. So what could some of the fossil fuels be? That would include propane, natural gas, diesel, or gasoline. And some of the equipment that I've seen in rinks include for sure the ice resurfacers. Ice edgers really seem to have a lot of exhaust come out of them, so we have to make sure our staff are using those with caution, thinking about the agenda and the time frame that it would take to ventilate the arenas if we're using ice edgers. Lift trucks that come into the facility when we're changing score clock lights or arena lights, or we're hanging banners from the rafters, that can certainly contribute. Gas-fired radiant heaters, special event equipment like monster trucks, dirt bike events. Ted mentioned car shows. Those can all contribute to the exhaust entering our facility and impacting the indoor air quality. As well, I've seen some rinks that have idle-free zones. So vehicles idling too close to a fresh air intake can cause exhaust gases to be drawn into the facility. So that's something we want our operators to be aware of, that you may want a no idle zone around those fresh air intakes, just to ensure our air is clean coming in. The exhaust from fossil fuel powered equipment can contain harmful gases. Two that we're going to discuss today for sure are the carbon monoxide and the nitrogen dioxide. And when I talk about a air quality program in your arenas, we really think these two factors should be monitored. And Ted said, you know, even the addition of alarms, that's great to have that standby monitoring occurring so that your staff can be aware if there is an elevated risk of carbon monoxide or nitrogen dioxide. Now, carbon monoxide, it's a colorless, odorless, and tasteless gas. It interferes with oxygen in the blood, and children are more susceptible to the CO poisoning, as well as nitrogen dioxide being a brownish gas with an irritating pungent odor. At levels normally associated with arenas, we essentially say that it's colorless and odorless, but it can certainly irritate lungs, air passages, and noses of people, spectators, and our athletes that are using our facilities. People with any pre-existing conditions like asthma, bronchitis, COPD can be more sensitive to NO2 exposures. So knowing that those are the two gases we want to look at, we have to have a monitoring plan in place. It's also important, I think, that our staff that are working in these rinks be aware of some of the symptoms that could be reported to them. Quite often, you know, it's flu season during hockey season, and some of these symptoms could be mistaken for a flu, but our staff should be aware if they start getting reported symptoms of headache, itchy or watery eyes, nausea, weakness, dizziness, rapid breathing, and at higher levels, fatigue, dulled senses, incoherent thoughts and speech, convulsions, unconsciousness, or even death could be contributed to CO poisoning. The NO2 poisoning symptoms that our staff should be looking for are coughing, irregular heartbeat, nausea, fatigue, rapid breathing, chest pain, flu-like symptoms, pneumonia, fluid in the lungs, or even death. We need staff being aware that these are the symptoms that individuals could be suffering from if there was elevated levels of CO or NO2 in our rinks. Next slide. So what are the recommended guidance? Ted went through the National Building Code. Our recommended guidance for public use is that during every hour that ice is used by the public, the average carbon monoxide level is not to exceed 25 parts per million. And as Ted had mentioned, the NO2 is lower, that the NO2 level, the average is not to exceed 1 part per million. So on your monitoring program, I would be going around, looking during floods, half an hour after floods, doing these walkthrough at head level, on the benches, at center ice and around the ice level, and in the public stands, making sure the carbon monoxide doesn't exceed 25 parts per million and the NO2 is below 1 part per million. And the main sources that we've seen that have caused these problems in these arenas are the ice resurfacing equipment not being maintained properly and the exhaust just being too rich, as well as the ice edgers being used too close to the time that public would be using the rink and not having enough time to ventilate properly the playing area, and the indoor air quality has elevated levels, which could be a risk. Next slide. So what does that lead us to? It's just the basis of today's presentation, that we need our arenas and our communities engaging in an effective indoor air quality monitoring program. And an effective air quality standards program will help your operators to control emissions at the source and control that indoor environment where our athletes and public could be monitoring or engaging in an activity. And it's important to remember that those people on the ice that are engaged in activities, they're going to be breathing at a higher rate. They'll be working harder and they could be more susceptible to any elevated levels of CO or NO2. So what would our arena operators? They could create and implement a 2-part air quality standard, a written program, and a monitoring program. So I'm going to discuss both of those. Next slide, please. The written program would outline a lot of details, like the type of internal combustion equipment that you'd have, identifying the edger, the frequency of its use, as well as the type of ice resurfacing machine you're using, and any other fossil fuel driven equipment. You're going to look at the last tune-up and maintenance frequency and make sure that staff are aware if the equipment has been maintained, when the maintenance frequency is. That would all be outlined in your written program. Now, the equipment modifications to reduce buildup of combustion gases should be outlined in your written program. Things like we've extended the exhaust pipe on the ice resurfacer. We leave the gates open if we're flooding. Those types of equipment modifications, is there a catalytic converter installed on the ice resurfacer, should all be outlined on the written program. As well, there should be a very detailed sketch or schematic of the arena ventilation. So you'd want to ensure that it's well documented where the air intakes are, the fresh air intakes, the exhaust ventilation, the ceiling fans. That should be all outlined for your staff, how they're powered, where the power supplies are, the on-off buttons if there's manual on-offs, or any timers that are attached to this ventilation system should be clearly detailed in the written program, just so staff know how to monitor and use this equipment. We've also seen, I know Ted mentioned that there's older arenas in our communities. That's certainly true. Sometimes we have local volunteers that want to come and upgrade the arenas, and we've even seen fresh air intakes be completely paneled over, or ventilation is changed without contacting the experts in ventilation. So before doing any of that work in your community rinks, we sure recommend that you consider the ventilation and exhaust areas of your arena. Also, you're going to want to look and document any time lags. So that would be when you're conducting tests. If it happens to go above 25 parts per million for CO or 1 part per million for any NO2, how long does it take before that air quality drops down below the acceptable levels? And that would be the time lags that you'd want to implement after, say, flooding the ice, to ensure that the public and the users are in the safe zone. Next slide. So I just put up, this will be a document that we are working on provincially and we hope to provide to our community operators. But it will be an arena indoor air survey. I know here in the Northeast, we've used it in our local arenas to help the public health inspectors understand what's happening in your rink, but also to ensure and document what's happening for your operators and your rink staff in regards to the equipment in the rink. So just quickly glancing, I know it's super small on there, but we will be updating these and get you some updated copies shortly. And maybe some of you have seen this form before on previous inspections by the inspectors. But when's the last known tune-up of equipment? Are they warming the equipment up before they use it? What type of fuel are they using in that item? Are there intake fans? And then that schematic on the right-hand side of the slide, you're going to see that would identify where is intake of fresh air occurring, where is the exhaust occurring, are there ceiling fans? And having that available for your staff to quickly look at will help improve the understanding and mechanics of your arena. So that's a good piece there. Next slide, please. That's a good piece on the written program. The second piece of a good indoor air quality program is the monitoring program and having good equipment to make sure that you can monitor for carbon monoxide and NO2 and ensuring that the levels are below 25 and 1 parts per million. That's going to be the monitoring piece that communities really should be engaging in if they're not doing that. We recommend a weekly test and during heavy periods. So nice to get a baseline during a heavy weekend tournament play after using ice edgers and really establishing what is the air movement and what is the time frame to ensure our air quality can be maintained and the facility can be open and in use. Monitoring recommendations. So when you have this equipment, you're going to want to be testing at breathing height, say at the player benches, at center ice and other areas of the ice. And if air quality doesn't meet the standards, you're going to test every 15 minutes until the standards are met. And you're going to record those results on a log sheet, and that will help you with the lag times that we were discussing earlier. You're going to determine and implement corrective actions like increasing ventilation, or was the ventilation shut off, or why are our numbers increasing? Or it may also just show that our facility is safe to use, and that's the advantage of doing our monitoring. We're in the know, we're making sure our facility is safe, and the public can use it in a safe manner. Next slide. I put a picture up of an old, back one. Yep, there we go. So I just put up an example of an air testing record, but this would be something that your staff should be maintaining in an arena. And you'll see this facility was doing daily tests. I took an example of a log sheet. They were making notes about very cold weather, or in this case, we saw some very warm weather that was, causing some of the ventilation issues we saw in some rinks this year. Every day they're making those notes. There's a tournament down, what the level is for CO and NO2, documenting and keeping those records, and then it helps us understand the air movement in our arenas. Next slide. So even with our best practices, and monitoring, we might see things change. So our equipment could change, the burning of the exhaust could change, and that's why testing is very important. So if your staff do see someone with symptoms of CO or NO2, we do have the following recommendations: that they vacate the ice and other areas of the arena until they can determine what is happening in that arena and why the levels are elevated. Immediately take any ill persons to the closest hospital or health center. Increase ventilation in the arena to get that fresh air, as Ted was describing, into the building. Get that exhaust air out and dilute that to safe levels. And always report any of these incidents to your nearest public health inspectors, and we can also come and validate some tests and try to assess what some of the problems could be. So just a little bit about abatement in your arena. I have a picture here. This here's a CO monitor that we were using, and we happened to walk into a rink, and right away we saw it had spiked up to 64 parts per million. So that would certainly alert the inspector, as well as if an operator was doing this test, that it's at an elevated level of CO in the facility. So in this case, we had observed that due to some warm weather that the ventilation was shut off, and that exhaust was just hovering in the rink. So we needed to turn that ventilation on, get the level to an acceptable level before we could allow patrons onto that facility. And that would be the same that your operators would be doing with routine monitoring of the indoor air quality, 25 parts per million or less. So arena operators are better able to control arena air quality by ensuring proper equipment operation and maintenance, monitoring indoor air levels, and maintaining adequate ventilation. So fossil fuel powered equipment such as edgers should be used only when the ventilation system can be run long enough to reduce CO and NO2 to acceptable standards. Next slide. This was another arena. It was interesting to see the carbon monoxide you'll see on that picture spiked well above 495 parts per million. So we knew there was something happening with this ice edger. They had maintenance come out from a company and look at this arena, and the fuel was much too rich. So when they tested the exhaust, they saw the carbon monoxide was in excess of 7% in the exhaust. And that for a propane burning ice resurfacer, it needs to be 0.5% or less. So getting the proper maintenance and making sure that your ice resurfacers are maintained will ensure that the proper exhaust is being ventilated. It was a very simple tweak on this ice resurfacer, and it made all the difference on the exhaust. The other piece Ted talked about, the containment piece of this carbon monoxide in this Zamboni room, could easily be exhausted to the exterior through a vent that's put on the exhaust pipe when you're warming up your Zamboni. So a few tips that we recommend with our ice resurfacers: extending that exhaust pipe 1 foot above the glass, keeping rink gates open during resurfacing, and of course, safety in mind. We don't want kids poking their head out on the ice, so you may want to monitor any gates that are accessible to the public so no one is around those gates during the flood. Installing catalytic converters on the ice resurfacer, for sure the annual tune-up of the ice resurfacer. Warming up the resurfacer before use is really important, and exhausting that warm-up exhaust to the outside would be recommended. And then ventilating the rink and reviewing your ventilation will ensure indoor air quality is maintained at acceptable levels. So some key points from today that I just wanted to discuss with the group is that your public health inspector is a good contact if you have questions. But locally, we can't be there every day. Your arena operators can be. So implementing an indoor air quality program at your arena is a must. Having proper testing equipment for carbon monoxide and NO2 is a must. So ensure your testing equipment is calibrated, up to date, and reading accurately. Do those tests frequently and make sure you're recording the results. If you do have any any problems identified while you're doing the testing, make sure staff are prepared to take the appropriate action. Getting the public out of an arena or closing the arena would be the appropriate steps with elevated levels. Ted mentioned this, and we agree, arena ventilation is crucial to good indoor air quality, and making sure that your ventilation systems are set up properly. If your communities have questions, they should be talking to the ventilation experts and making sure you've got proper air movement and the acceptable levels of NO2 and CO2 can be maintained. Annual equipment maintenance on your ice resurfacers and your edgers is a must, making sure they're burning as clean as possible to limit the CO that is left exhausted into the arena. And occupational health and safety should be considered for your staff at all times. So that's what I presented out. Those are some of the key points, and I'll certainly entertain any questions at the end of our session here. Thanks for the opportunity to talk with this group.
Okay, thank you, Ryan, for sharing your expertise. So it's a good segue into our next presenters, Warren and Jason from DMA Applied Controls, because as you heard from Ryan, testing is extremely important. So Warren, we'll get you set up to sort of share your screen, and the floor is yours, it looks like.
Excellent. Thank you, Tim. So my name is Warren Teely. I'm with DMA Applied Controls. I'm one of the senior automation technicians here. I'm joined today with Jason, really hard to pronounce last Ukrainian name, Lewandowski. We're here to go over some of the products that we offer. And I do have my slides on my other monitor here, so I'll be looking over a little bit. So you'll see the side of my face a little bit. I've been told that's my good side though, so should be okay there. So I'm with DMA Applied Controls. One of our main product lines is Honeywell Analytics. And I'm going to go over a couple products that we have in that line, the E3 Point and the 301C. Oh, and I'll just turn, there we go. So the E3 Point, we have a couple options. There's a standalone version and a network version. It's able to monitor carbon monoxide, nitrogen dioxide, hydrogen sulfide, oxygen, hydrogen, methane, and propane. Each of them is equipped with a visual and an audible alarm. So when these things do trigger and go off, you know that there's an issue there. So the standalone version has a dual gas option. Typically what would happen is you would run a remote sensor as well. They have 2 relay outputs and 1 analog output that allows you to hardwire these directly into some type of ventilation, horn strobes, that type of equipment. The network version is single gas, and it has 1 relay output, as well as it's capable of communicating with industry standard protocols such as Modbus and BACnet MSTP. The cool thing with these ones is they have a sensor cell that can be replaced or swapped. I don't know if you can see my cursor here or not, but right above the display is where the sensor cell is. And it's just a matter of popping those screws, swinging the cover down, and that cell, if it's for some reason it's faulty or reading off, you can pop it out, put a new one in, and close it back up, and you're good to go. They fairly easy. You don't have to change the whole thing out, in and out. So these sensors are rated for -40 degrees Celsius. The carbon monoxide version of them, though, is only rated to -20. So fairly well, good range for things like arenas and rinks. Each sensor can cover a 50-foot radius as well. So for a rink, it gets you a majority of the rink surface. As well, we recommend annual recalibration on each of these. So we do provide that as a service. If you have enough of these, we can provide you with equipment to do that. The test gases do have an expiry date, and so unless you're doing a majority of them, I would recommend just having us provide the service for that. But if you have a bunch of these, by all means. And then as well, I threw in here the installation heights of some of these. So the carbon monoxide, we recommend 3 to 5 feet. Hydrogen sulfide, the other one you're looking at is the nitrogen dioxide. We recommend, Honeywell Analytics recommends from the ceiling. However, there's a note here that it may differ in different applications. The reason they typically go with the ceiling is because exhaust systems are hot and NO2 will rise in that case. But as Ted mentioned earlier, NO2 typically is heavier, and in a rink those will probably cool down. So that might be one application where we would recommend putting it lower than higher. So next, I'm going to go talk about the 301C module. So this, what would happen is the networked version of those sensors would all link together and talk back to the 301C module here, which would be like a main front end for that. You can do up to 126 programmable zones. It is capable of providing a BACnet output, so that if you have, say, an automation system in your facility, you can integrate that with your automation system. It has relay outputs, again, for equipment control. So again, if you want to turn on different types of ventilations, remote horns and strobes, that type of stuff. As well, it's got a built-in data logger, so you can go back and it'll keep samples of a record of all the measurements and when the alarm's triggered. There's, again, audible and visual alarms. And then there's also additional sensors for this that you can do refrigerant detection. So if you have like chiller plants or things like that, we can watch for refrigerant leaks as well. So I took an example of one of the previous facilities we've done. This is a 4-rink facility, and you can see in each rink they provided 4 COs and 4 NO2s, and basically around each corner to try to get as much coverage as possible. They've also provided CO within the main corridors, and also in the Zamboni rooms. They've got 2 rooms here for the Zambonis. They have carbon monoxide, propane, and methane monitoring as well. And you can see this is they have a fairly large number of sensors, and each one of these is given an address. So this is a networked setup where they would go back to a 301C. There's actually a second floor on this building, which I don't have here, but you can see the main facility here. So, and then the other thing I was going to go over real quick is that even though those are the two main products I just want to talk about real quickly today, Honeywell does provide a full line. As you can see here, this is actually industrial level stuff. So we go all the way from commercial all the way up to industrial. There's a wide range. It's where you're not just stuck with the 3.301C as well. We do provide different vendors as well. So we do have, we can provide different, such as Critical Environmental Technologies, QuatroSense Environmental, Opera, and Armstrong are a few of our other lines as well. So there's many options, many variations, and whatever kind of customizable application you would need, there's options out there for that. So that basically wraps up all I had to talk about. So with that, I will pass it back to Tim.
Thanks, Warren, for your presentation. I know I have a few questions, so I'll be coming back to you in a minute or two. Okay, I'm going to do my presentation now. I guess being the last one, you're going to hear a little bit of duplication, but I'll try to be quick and not bore anyone, and then we can get on to the question and answer period. So SPRA created a fact sheet back in January 2019 that was for our industry and to provide some information and some practical advice on what you can do with your indoor air quality. And this fact sheet was recently updated December 2023, and you should have received a link to that fact sheet in your meeting reminder. Okay, so if you have access to that, you may want to open it up now, or you can look at it later. I do appreciate the assistance to update this fact sheet from the Saskatchewan Health Authority. Okay, the fact sheet. Let's go through it quickly. Managing indoor air quality certainly isn't as easy as measuring your ice thickness and logging that information. Okay, as you heard today, we should have a practice in place how we can monitor and know where our indoor air quality is at. And as Ryan mentioned, it's something that's really lacking in our industry overall. And of course, we learned about the two major toxic gases that we're dealing with. Okay, that's CO and NO2. And again, we heard that internal combustion engines are the main sources of that, but we also know that there's other things happening in our buildings as well that can cause a bad situation. Again, just to emphasize that as an owner-operator, we have a legal responsibility to manage the air within our facilities, and we have a responsibility to ensure that our staff, our facility operators, are trained. Those trained facility operators need to follow those established policies and procedures and practices that you have, and be aware of symptoms that may be created within your building. And then most important is, how do you respond if you ever get in that situation where you definitely have an indoor air quality happening. And finally, we need to understand how to monitor our indoor air quality and record those results. And this is a basic question. How do you know the level of toxic gases within your facility if you're not monitoring? You really don't. And that was the point that Ryan was driving home in his presentation. There's different types of monitoring systems as well, and Warren briefly showed us what a fixed system would look like, but there's also personal ones that are available as well. And my personal preference is the personal monitoring system because they're often more affordable, and being portable, you can take them to other parts of your facility as well to ensure that your boiler room has proper air quality, etc. Remember too that residential monitoring equipment, if you find something on the shelf at a local hardware store, isn't going to be the same quality that you need in a commercial equipment. And not all commercial equipment is created equal as well. And as Warren mentioned, you have to make sure that the systems are designed to work in an arena environment, which can be, very cold temperatures, different humidity levels at different times of the year, etc. And perhaps having a number of different monitors is the way to go for maximum coverage. Remember too, programming is an important part of the indoor air quality equation in your facility. Saturdays can be worse than Wednesday evenings because the number of floods taking place on a Saturday would be much more generally than you would on a Wednesday night. So you have to adapt your procedures and practices accordingly. Remember summer events too. There can be impacts from tractor pulls, car shows. We've talked about that earlier. Just remember that indoor air quality is not simply a winter issue. On page 2 of our fact sheet, we talk about some of the best practices, and I'll go through these fairly quickly as well. Okay, make sure you know about indoor air quality and how it relates to your facility. In most of the courses that SPRI offers, we talk about there's no two arenas that are exactly the same out there. So you may have to customize your indoor air quality testing and monitoring to work in your facility. Your local public health inspector is a great resource, and Ryan certainly was one of those representatives today. So make sure you know who your public health inspector is. Make sure you have a plan in place to deal with an indoor air quality emergency and how you would evacuate your facility, and then practice that at least once a year, just so everybody's on the same page. Annual servicing and testing of your ice resurfacer and edger are very important, and make sure you document this work that's being done. And one thing I found that worked really well was if you partner with other arenas in your area, you can have a service tech come out and do all your equipment sort of at one time. Switching to an electric edger. I've gone through those struggles with a gasoline powered one and then a natural gas powered one. They're always finicky, never started. And having an electric edger is better than sliced bread. So that's a little bit of, I guess, advice from my background. Electric edger, again, you avoid a lot of those issues with air quality, and they're so much easier to operate. And then, of course, you can consider switching from natural gas if you're currently using a propane or gasoline ice resurfacer now. And, of course, the electric ice resurfacers are coming on the market, but right now they're very expensive. Okay, ventilation and air circulation are two considerations, but you've also heard that exhausting is important as well. Okay, run ventilation systems at least 5 minutes before your flood and 10 to 15 minutes afterwards is sort of an industry best practice. Training, make sure your facility operators are trained and they know what procedures they need to do, and don't take shortcuts. If the ventilation system needs to be on, make sure it's on. Extend the exhaust pipe of the ice resurfacer so it's above the glass, okay, because the rink boards in the high glass can create a bowl for your emissions to sort of sit in. And make sure you invest in the monitoring systems and make sure you log your indoor air quality. Catalytic converters, some ice resurfacers, that's been removed, but they should be installed and functioning properly, and warm up your engine for at least 5 minutes. During that warm-up period, try to vent that exhaust system to the outside as much as possible, okay, either through mechanical means or you've heard from several mentioned just put a storkel over your exhaust and vent to the outside. Watch for and prohibit vehicles. We've heard about this already. Buses often will idle near some sort of doorway or entranceway or even some fresh air intakes, and having one or two vehicles idling outside these things can dramatically and quickly impact your indoor air quality. So conclusion, owner-operator has a legal responsibility to manage the indoor air quality, and you heard both perspectives from occupational health and safety and also from a public safety perspective. Boils down to recognizing the standards and creating a plan to deal with the issue. The indoor air quality plan may require an investment in new mechanical systems or improved mechanical systems. Indoor air quality plan may require an investment in monitoring systems as well. And an indoor air quality plan may require adopting new procedures and or making some simple changes to operations to help minimize the potential impact. There's lots of resources out there too if you're interested. Just search the internet. The federal government has a good document as well. That's the one that's located here. I'm not sure if you can see my cursor. The Ontario Recreation Facilities Association has a good document right here. The government of Manitoba has this particular document, or sorry, WorkSafe BC has this document. So there's a bunch of information out there, and if you're curious, I can provide you some additional information after this webinar is over. Okay, so now it's your turn. We strongly encourage you to engage in our conversation today, and I'm sure some of you have questions. So if you want, you can raise your hand, unmute yourself, and or you can use the chat function to ask a question. Okay. So I'll throw it over to Christy if she has anyone asking any questions at this time.
We do. We have Wowoda. Wowoda, please feel free to unmute your mic and ask your question.
Okay, very simple question. Where can we get equipment, and do you have any recommendations?
Is that a question for Warren? Jason?
What type of equipment are you inquiring about?
Monitoring equipment, the handheld. I saw the Fluke CO220. Where do we get equipment like that? And is that the best one, or is there another recommendation that you would pass along so that we can monitor?
I can't speak to, this is Jason here with DMA. I can't speak directly to the Fluke one. I don't have any familiarity with that. We do sell handheld monitors here at DMA. They're BW Technologies, which is another arm of the Honeywell offering. So if looking into something for handheld monitors, we do have access to that, so you could reach out to us at DMA, or I'm sure there's other sources as well. I think just by looking at the Fluke one, just by doing a Google search, I've found the Fluke on there, that they probably are being sold by electrical distributors and stuff like that as well.
Are you able to share for us what the cost would be for a portable monitoring device?
They'll range quite. I think I haven't. They don't have recent pricing, so don't quote me on this one. But BW Technologies, a CO handheld might be around the $1,200 range or something like that.
Okay, that gives us an idea.
And then if you were looking for NO2 as well, that would be, I think, a separate meter. I'm not sure if you can get CO and NO2 in one meter as a dual meter, but definitely we can look into that. But the NO2 sensing tends to be more expensive than the CO sensing, just by experience.
Okay, that gives us an idea. Ryan, from a health perspective, do you guys use a particular monitor?
Hi, Tim. Yeah, so from SHA, we can't recommend one brand over another, but I will tell you that there are CO and NO2 handheld monitors that are both in one unit that we do have quite a few arenas using. And those are available through many electrical companies as mentioned. I believe one's called an Alt-Air that is used. There's certainly the one from DMA would be worth investigating. And then just Google searching them. We've seen some arenas have luck just Google searching for, quite accurate meters that are available for handheld. I would mention that if you can find something that is self-calibrating or easily calibrated for your staff, that would be a recommendation for us. So they're not having to do bump tests with gases and those types of things. So just fresh air calibration handheld units would be a recommendation.
Thanks, Ryan. Christy, any more questions? Anyone out there?
We're not having any come in yet, but okay. Please feel free, if you do have a question, just throw it in the chat or raise your hand and unmute your mic.
Okay, well, while we're waiting for more questions, I'll ask a couple here. As far as the alarms that you were showing, Warren, okay, do those monitors have different thresholds? So they would alarm or flash, I guess, at certain levels?
Yes, that's right. There's actually 3 alarm levels, I believe, in those particular ones. So at 25 ppm, for example, for carbon monoxide, we would turn on ventilation. At 100 ppm, we may trigger the alarm. There's actually a 3rd alarm level as well. And those can be adjustable based on your requirements. So maybe you want to start the ventilation before 25 ppm. But yeah, no, it's completely adjustable. The 301C, which was networked, same idea with that. It's programmable at different levels as well. So,
thanks. Question for you, Ted. Okay. If we wanted to, in our facility, look at improving our ventilation, exhaust, and circulation, and we wanted to reach out to you and have you start the process, what does that look like?
Because every building is different, every rink is different in terms of how it was designed. I would probably start with approaching a qualified person, mechanical design engineer like HDA, or someone else to get you an assessment. So if you think you have, I would first say I would do the monitoring piece to figure out if you actually have a problem, right? If you do have a problem, then you probably need to get the mechanical systems assessed. And with that assessment report, you would be requesting that they provide some recommendations to improve the ventilation, or again, address those if you're not getting your CO and O2 down in concentration levels, and what can be done. And they should be able to give you options and budgets to achieve that. And that, of course, would change with every building, right? Depending on what you have there, how well that system's working. In some cases, you might be able to modify air delivery just to get better mixing. In other cases, you're going to have to increase the air change rate, which would mean more exhaust and more outside air, and that comes with equipment costs, right? Or again, even just looking at air cleaners, air purifiers, if you think you can recirculate and remove enough concentration levels without increasing your outside air load. But yeah, I would start with that.
Oh, sorry, Ted, go ahead.
I start with determining if you have a problem. If you have a problem, I would contact a company to do a mechanical system assessment aimed at indoor air quality. I have an indoor air quality problem I want to address.
Okay. I agree with where you're going with that. Yeah, monitor to see if you have a problem, and then look at an assessment to see how you can best solve that problem. If a facility finds that they do need to examine that mechanical system and look at investing in some improvements to that, is it something that can often be done in phases as financing becomes available? Or is it more of a one shot is best?
No, like the assessment will be done in one shot, with my assumption, and then you can have phases within there. Again, whoever you get, if phasing is something you want to look at, I would tell the person assessing it that's how you want to approach it, and then the report would detail, what should be done first and its costs, and then you can keep building off of that to improve the building.
Okay, perfect.
Right. So you can certainly do, in most cases, some level of phasing.
Okay, perfect. Any questions come up yet, Christy?
Yes, we do have a question in the chat. How frequently should those alarms be calibrated or replaced if they cannot be calibrated?
Yeah, I'll speak to that. So with Honeywell Analytics, the E3 points, our manufacturer recommendation is once a year to calibrate and test them. As long as they meet the calibration and everything's working properly, they don't need to be replaced. Obviously, if they can't, those ones in particular can be recalibrated. Some of the cheaper variants may not be. You might have to throw them out. Again, it would depend from manufacturer to manufacturer, but with the 3 points, it's just a matter of swapping the cell if you need to. But yeah, short answer, once a year you should be checking it, or more frequently if you can. So.
So I guess I was going to follow up with you too, Warren, as far as a permanent monitoring system. What process do you follow? I guess you would come out and look at the facility and then make some recommendations where to place them and how many, those kind of things.
Yeah, absolutely. Yeah, as Phil mentioned earlier about having a schematic for the ventilation, having a floor layout would be really helpful. Seeing the ceiling heights, those type of things would be nice to know, to figure out best locations for the sensors and what kind of coverage we could offer for that. So yeah, probably a visit to the site would be worthwhile, and then from there come up to a suitable solution. So
Okay. I don't mean to put you on the spot, but if you had to, like, what is a permanent monitoring device worth? Do you have a rough idea? I realize it's all based on the facility and so forth.
This is Jason here with DMA. I can speak to that, I guess. The CO sensors, it all depends if you're looking for a standalone or the network system. There's different prices, but a CO detector is probably around the $800 range for a fixed sensor. And the nitrogen dioxide sensors, I said, were just because of the sensing technology of the NO2 sensor, they're more money. They're closer to the $1,000 range a piece for the fixed. And then all depends how big you want to get with the whether you're using a main 301C controller or just the standalone system. But I think that gives you an idea. So anywhere from the probably $800 to $1,000 a sensor range.
Okay, that's great. Any more questions at this point, Christy?
Don't have any right now, no.
Okay, well, I might just go around the table then and give our presenters sort of a final opportunity to make a comment. So, Ted, I'll start with you. Do you have any final thoughts?
I would just stress again that this goes for all buildings, whether they're rinks or not. You need to properly ventilate occupied spaces, especially moving forward as buildings and focus on energy causes buildings to be sealed up more. Ventilation is very important to keep occupants in the building safe. All right, and then when you have actual contaminants like CONO2, that becomes more critical. So proper ventilation.
Okay, thanks, Ted. Ryan, how about you?
Yeah, Tim, thanks again. Here I mentioned it, but thanks for the opportunity for joining this webinar today. Just really encourage our community operators to implement a indoor air quality monitoring program and train your staff on what to look for in regards to CO and NO2. Thanks again.
And when that information does become available through the health authority, please feel free. We'll partner with you to distribute that as well.
I like that idea, Tim. Thank you for that.
And Warren, how about a final thought from DMA?
yeah, more on a personal note, when I was younger, I had a sibling who actually had CO poisoning. So again, I would emphasize, get that monitoring put in place, do some checks. Knowledge is power. You don't know what you're dealing with if you're not testing for it. So definitely get that in place. So.
Okay, thanks, Warren. And I guess to wrap up, we're getting very close to 11:30. So I just wanted to thank the presenters for sharing their time and their expertise this morning on a very serious subject matter. Okay, I'll send out their contact information on our post webinar email. So yeah, reach out to professionals like Ted and Warren and Ryan. I don't know if you want all the responses to you, but contact your local health person as well. Thanks to the participants for participating in our webinar this morning. I think we were close to 55 registered. So I know everybody wasn't able to attend, but the recording will be made available after the fact as well, and we'll share that link with you. And I just wanted to thank the SPRE team for their assistance in coordinating the webinar. So Ryan and Christy, thank you very much. And if you need more information, don't be afraid to reach out to me as well and contact me. So again, thank you all very much. I would ask the presenters to stick around, and this concludes our webinar. Thanks for attending.